Celiac disease is an autoimmune disorder that is estimated to occur in less than 1% of the population. It is a genetic disease that causes the immune system to attack the cells lining the small intestine after absorbing the protein gluten, which is found in wheat, rye, barley, and occasionally oats. When a person with celiac eats something containing gluten, it is digested and travels to the small intestine. The small intestine is where you absorb nutrients. But when a small intestine cell absorbs gluten, the body of a celiac person now views it as intrusive and foreign, causing the body's immune system to attack itself. A healthy small intestine has villi, which are small projections that line the small intestine cells to help absorb nutrients. Celiac disease causes extreme damage to the lining of the small intestine, causing villus atrophy. This can cause pain to the person as well as malnutrition as the small intestine struggles to absorb nutrients. I had been experiencing an array of symptoms, including exhaustion, stomach pain, nausea, canker sores, irregular menstrual cycles, and a dangerously low weight. I was in and out of doctors' offices sometimes multiple times a month for almost a year. I was tested for, it seems, everything under the sun. I had x-rays, an ultrasound, and too many blood tests to count. During one of these visits, they took a blood sample to be tested for an antibody called immunoglobulin A, found to be in high concentrations for autoimmune disorders. They sent off the blood test, and when it came back, I had tested positive, with 50 units per milliliter. A normal person is supposed to have less than 4. My doctors were then fairly positive that I had celiac disease, but to make sure, they scheduled me to have an endoscopy, where I had to have my small intestine biopsied. After the surgery, it confirmed the diagnosis as my villi were almost completely flat. That was a year and a half ago. And since then, I have been on the only solution available, abstinence. I have been on a strict gluten-free diet for a year and a half. Unfortunately, this solution is riddled with difficulties, as it is impossible to assure that I will never accidentally consume gluten. In today's world, it is very easy for my food to be cross-contaminated with something else. Whether it is using the same utensil or even if something's fried in the same oil, I could get glutened. Celiac is kind of a chameleon with symptoms, but when I'm glutened, I feel like I have food poisoning, with extreme pain, severe nausea, and swelling. One case of cross-contamination is detrimental to my small intestine. When a healthy celiac patient is glutened, it takes anywhere from 6 months to a year for their small intestine to fully heal. And even when maintaining a strict gluten-free diet, 40% of celiac patients still show signs of inflammation and damage to their villi. But I am hopeful that there might eventually be a cure or a way to prevent people with high risk from developing it, largely because of the quick advancements that the biomedical industry has made using mice models. In 2020, researchers at the University of Chicago, including Valerie Abadie, developed the first truly accurate mouse model of celiac disease. The mice had the same genetic and immune system characteristics as humans who develop celiac after consuming gluten, and the symptoms lessened and dissipated once the mice went on a gluten-free diet. It has been more than 3 years since then, and the research is still underway using these mice, and advancements are being made by the day. A Japanese pharmaceutical company published encouraging results in a non-clinical study on December 25, 2023. Chugai Pharmaceutical in Tokyo developed a new antibody called DONQ52, which was designed to target an immune complex that is known to cause symptoms when people with celiac ingest gluten. To determine if it worked, they performed a series of in vivo and in vitro experiments. The in vivo experiments are conducted in a living organism, and they used the mice. And the vitro was in a sterile laboratory dish. They discovered that DONQ52 was successful in blocking the immune reaction to gluten in the mice tested, while still leaving the rest of the immune system intact. They are now currently conducting clinical human testing here in the United States, and we are hopeful that DONQ52 will turn into a viable treatment option that could improve or even replace a lifelong gluten-free diet for patients such as myself. And none of it would be possible without those mice. Thank you.